Hello, and welcome to the Omni-HealthData Insights overview of the Hospital Patient Experience Info app from Information Builders. Omni-HealthData Insights is a suite of 5 powerful info apps that are pre-built for hospitals, integrated delivery networks, and physician practices. They are developed on the award-winning Omni-HealthData platform in partnership with St. Luke's University Health Network, a fully integrated and nationally recognized 10-hospital system with 300 outpatient locations. Among their 120 healthcare quality awards, they are consistently recognized by Truven for the top 100 hospitals, top 15 teaching hospital, and the Drexel Analytics Award. They are recognized by U.S. News & World Report for Best Regional Hospitals and have achieved the HIMSS Stage 7 designation for its entire system. By harnessing this full suite of info apps, St. Luke's has reported a 10 times return on investment. In other videos, we did an overview of info apps that managed hospital patient quality and safety, as well as operations and finances. This overview will focus on patient experience. Whether I'm the patient experience officer, a service line leader, in nursing or operations leadership, or a clinical analyst, this info app is the key to improving patient experience. For this overview, we will assume the role of a director in our hospital system's Office of Patient-Centeredness. Let's say we recently heard from nursing leadership that there were Joint Commission findings for one of our hospitals, Columbia Medical Center, regarding processes in transitions of care. Being proactive, we decide to look at patient experience for this area over the last 2 years. Our filters allow us to narrow our search across any number of parameters for the 5 integrated data sources for this info app. Here, we want to just isolate the results to the transition of care domain over the last 2 years to get a big picture of how we look. Our heat map is grouped by hospital and unit. The size of the boxes represent how many responses each unit got for just the transition of care domain within the HCAHPS surveys. Color ranges dark to light for best top box scores to worst. Indeed, we can see that our 3 MedSurg units only have low 50s and mid 40th percentiles for their top scores for transitions of care, and our ED is at 30.6%. We can also quickly note that J&C Rothschild Hospital has 3 units in the 60th percentile for this domain. Those scores are on par with national and state averages, so we will keep them in mind as units to hold up as positive examples to be studied and duplicated. Now, let's dive into 4 West, since it has over 1,000 responses. We can see a significant dip in performance for the spring and early fall times, with August in particular, which has some alarming never responses, and a top box score that month of only 45%. Investigating further, we can dive into actual responses at the encounter level. Scrolling down, keeping our eye on the never column, we can see several strongly disagree responses, especially concerning when we get to the point of clearly understanding discharge medications. Keeping in mind we are only looking at the transitions of care domain, at this point we decide we'd like to have the info app completely reconstruct the survey for one of the patients concerned. We can see that we had excellent top box rated responses for all questions for every domain except transitions of care, and we make a note to ourselves to follow up on this pattern. To better understand the aspects of what we have found, we decide to look at scores by service line. General medicine is usually responsible for discharge and transitions of care, and indeed, we see the highest number of attributed responses at nearly 3,000. Drilling into the service line breaks responses down by diagnosis-related groups, sorted descending by number of responses. Looking further, we see that unspecified sepsis has the greatest number of responses and only a 70% overall top box score. We can look at correlating the two through our self-service analytics interface by selecting internal medicine and transition of care as options. Upon display, we can see by the low scores, a correlation is strongly suggested. We can drill to another level of detail, picking August again, review these combined data, or stop at any encounter and have the info app reconstruct an entire survey when we would like. We decide that we definitely have an area of opportunity worth further investigation to help improve future Joint Commission surveys. Having done that, we also have a request to follow up on from our VP of Network Practices. She has asked which physician practice would be best to implement a new pilot she wants to do for patient engagement and retention. Looking at our practice scorecard view, we can see our practices ranked with the best at the top, the bar charts indicating performance, next to the number of responses. Across these two dimensions, we can intuitively see that IB Health Internal Medicine has the highest response rate with about medium performance. Looking at provider attribution, we see there are several doctors that have over 100 responses, but top box scores less than the 50th percentile. We can even check those surveys by the provider's role. In only a short amount of time, we feel confident in recommending this practice for her pilot implementation. The Hospital Patient Experience Info app is designed to gain actionable insights such as these across one hospital or dozens at a time. From the boardroom to the back office, this user-friendly info app helps leaders and staff at all levels plan and work more efficiently and effectively to achieve hospital system goals. A single source of truth viewed by all. The info app is being fueled by several key sources. These data are cleansed, mastered, and enriched with all relevant healthcare code sets and clinical ontologies, and because they are refreshed from these systems nightly, they are always as near real-time as possible. Each year, hospitals put millions of dollars at risk based solely on patient satisfaction. With the Hospital Patient Experience Info app, you can expect results, including those listed here and many more. We would like for you to become our next success story in healthcare, our fastest growing industry. All of our customers benefit from over 40 years of industry leadership, award-winning customer service, and the most advanced data and business intelligence platform technology, thanks to the feedback of tens of millions of users from all industries around the world. We hope that you enjoyed a day in the life of a director in the Office of Patient-Centeredness. We look forward to following up with you to help answer any questions you may have about how the suite of info apps in Omni-HealthData Insights can help your provider organization meet the challenges of modern healthcare. Information builders. Better data, better analytics.